Here's a contrast-enhanced CT that was performed in a patient with a history of malignancy, and a CT chest had been performed prior, which showed partially this liver lesion, and so they wanted it further characterized, and so the CT was performed in the portal venous phase. You can see that this liver lesion measures around 6 centimeters, 6.5 centimeters, and it looks very low density. There are these linear septations within it that we can see coursing through it. And while metastatic disease is in the differential for this, given its these linear septations within it, one also has to think about the possibility of an abscess. The other thing that kind of supports this being an abscess is you can see the hyperemia involving the adjacent liver, which can be seen from inflammatory responses. So this was actually thought to represent metastatic disease rather than an abscess. Abscess was not put in the differential. So this patient actually went for a biopsy. And here we can see the biopsy that was done. This lesion looks quite echogenic, and abscesses can actually look echogenic in certain phases of the abscess formation. A biopsy was performed here that went right through the echogenic areas, and so this just came back as necrotic tissue, and so there was a request done for a repeat biopsy. When the repeat biopsy was performed, the ultrasound image you can see here looks quite different. It's, rather than being echogenic, is more hypoechoic. And the other thing that was interesting about this, or confirmatory that this was an abscess, was the fact that it was decreased in size from the prior examination. So our approach when we were doing the biopsy here was actually to get part of the normal tissue and then get into the lesion itself, so that if this was indeed a necrotic metastatic lesion in which you would have viable tissue right at the periphery, if you get some of the normal tissue, then you would get some of the abnormal tissue and then necrotic tissue as well, so that you could confirm that there was indeed tumor cells here. But in this case here, the pathologist just saw normal tissue going into what looked like necrotic collection, and so this was confirmatory of being a hepatic abscess.